Hello, everybody. It's me again. My name is Beryl from the Eyes of Hope. Yes, our today's topic is very sensitive, very difficult, but I will try. Yeah. Today, I want us to talk about palliative or palliative care. Yeah. This is a very big topic for me. It's very sensitive, just like I said, but I think it's still part of us, and it's very important to talk about it. Yeah. So let us go first into knowing what palliative is. Yeah, what is palliative? Palliative is a special medical care to relieve pain, provide comfort, and give dignity to people with serious, incurable illness, and even to their families. Yeah, to this serious, incurable illness are like, for example, like cancer, heart failure, or any other. There are very, very many, but I cannot count all of them because otherwise the video will be too long. Yeah. Yeah. Just like most of you, I think it's not easy to talk about such a topic because just like I said, it's big, it's heavy. My heart is also heavy, but it's a topic that needs a little bit of awareness. Yeah. That's why I'm here today to create awareness, to create um, how do I say, to give some hope, to give strength. Yes, it's easy to talk about birth than to talk about serious illness or to talk about death. Yeah, but just like I said, we are all human beings. Nobody knows when it can occur. Nobody knows when it can get to one of us. That's why it's very, very important to talk about it because it's part of us. Yeah. Just like life, not life, but birth is part of life, death or serious sicknesses are also part of life, sadly enough. Yeah, I have to say so. Yes, palliative care or palliative patients, we consider a patient palliative immediately they get this diagnosis of the incurable diseases. Yeah. Yeah. Palliative care, there's this part of palliative which is called palliative care. It deals with how to cope with this disease or how to cope with the side effects of this disease. Yeah. And just like one of the palliative professionals, I would like to tell you, mostly we focus on supporting both patients, families, and teach them how to live a quality life despite the diagnosis or despite the side effects. Yeah, because I think the most important thing for human beings is to have a quality, dignity life. Yeah, and that's what we are as palliative professionals try to do. Yeah. Another thing is palliative care focuses on holistic needs of the patients and of the family. Yeah, like for example, it focuses on medical support, emotional support, spiritual needs, and like when a patient has small children, it ensures that these children are well taken care of emotionally, psychologically. It also ensures that the children are protected. Yeah, but I would like to say it's also important to tell the children whatever is going on. But in this case, we have to be very careful. We have to consider the ages of the children. How old are they? What kind of information can they absorb? Can they really understand? Because if they are in a very small age where they cannot understand, then I think it's not good when we interfere with their brains and yeah, you know what I mean. Yeah, but when they're a little bit older and can understand, then I think it's always good to tell them about whatever is happening. Yeah. Yeah, another thing is palliative care takes care of the choices of the patients. It also takes care of the psychological issues. Yeah, because most of the patients immediately they get this diagnosis, they fall into depression, which I also understand as a human being. Yeah, you know, when something like this happens, we always think it's too far. Yeah, because at the moment when you are still healthy, you don't think about that. Yeah, you only think about the good things, the positive part of it, but it can come anytime. And that's why most of the people, when it comes, sometimes it comes unexpectedly. There are some cases where somebody, maybe they expect it, they know, okay, my health is not good, and they expect it. Yeah, but in most cases it comes unexpectedly. And that is why I want to go a little bit into this part. When it comes unexpectedly, or it doesn't matter, whichever way, we have to be there for our patients. We have to be there for our families. We have to be there for the friends or relatives. We have to support them emotionally, morally, religiously, in whichever way we can. It's very important. Yeah, another thing is most of the people always think when you talk about palliative or palliative care or palliative diagnosis, yeah, that is like, oh, the patients will die the next day or the next minute. No, 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 no. I just want to encourage you and tell you it's not always like that. Sadly enough, there are some patients when they get this diagnosis, they get a lot of complications, they get a lot of issues, and their life ends so fast. Yeah, but the same way, there are also a lot of patients or a lot of people when they get this diagnosis, they fight, they live for months, they live for years. That is something that nobody can understand, because every human being is different. Yeah, and I think the only person who has the answer to that is God, yeah, who created the human being. Yeah, so I'm just here to tell you, please, 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 when you know anybody who has this palliative diagnosis, or even if yourself have it, don't give up on yourself. Be a fighter. Try to live a quality life. Try to get the support that will be provided. And if you feel like you cannot do it alone, please go for help. Seek advice. Seek support in whichever way. Okay, anyway, I wish you all a healthy life. I wish you all the best. I'll be happy to read your comments. If you have more questions or if you have more comments, I'll be happy to read them all and I'll get back to you. Thank you so much. This is your girl Beryl. See you next time. Bye bye.